Hey guys, it's Dr. Brandie for another episode of Pregnancy Pain Sucks. I have an awesome guest on today, and we're going to talk about some deep topics. So, Erin, if you could introduce yourself to our audience.
Sure, yeah. My name is Erin Woodbridge. I'm one of the co-owners of the Willow Space for Trauma Treatment in the main line of Philadelphia, and we're an experiential trauma outpatient center. So we do outpatient therapy for all different kinds of trauma disorders, that kind of thing.
Yeah, and that's very prevalent. You and I met a couple of years ago, and then we met again when I
Mhm.
launched the Bloom Sanctuary. So, thank you for coming to that. I'm trying to make a safe place. I know you're making a safe place locally. And the reason I brought you on is because I've had two recent guests. One was talking about infant loss, and the other one was a doula who was in the trauma space and is now owns a business with doulas and supporting people with trauma informed care. So, what's your definition of trauma informed care and why you started your facility?
Oh yeah, great
Good
question.
question.
So when we talk about, so there's trauma-informed care, which I think is like the hot buzzword of being mindful of consent, being mindful of asking permission, making sure that you're being transparent and leading clients or patients along the way and explaining what you're doing, why you're doing whatever it is that you're engaging in, and why that's important. And so I think, within the mental health space and healthcare just in general, there's an overarching like agreement. Yes, we should all be trauma informed. Taking it one step further, we are trauma focused. So our lens and how we are conceptualizing our care, why people are coming in, why people are even having the struggles they are, is all through that lens of the trauma focused care. So we're looking through the lens of EMDR therapy or internal family systems therapy and really trying to understand through those specific models how someone got to where they are and what we can do to help alleviate that pain. So I like to make that distinction too, because it's kind of a layered approach.
What got you into like what was the gap in care that you saw that you really felt the need for that in the mental health space in our area?
Yeah, so my husband Joe Woodbridge and I founded the Willow Space in 2022 because we both have had our own separate journeys working in all levels of care, so residential, partial, IOP, regular outpatient, in various capacities. We've had some overlap working in similar places and seeing just how much of a need there is for the trauma focused care. So, really focusing on those trauma symptoms. And what that looks like could be increased anxiety or depression. It doesn't always mean it's a PTSD diagnosis. And so that in and of itself was a gap, is that traditionally within healthcare, and there are some nuances with billing and insurance where you do have to meet certain criteria in order to be accepted and get the kind of care that you need, but it doesn't always look like PTSD, classic symptoms. So we were seeing a lot of those kind of like subclinical presentations where I'm not quite meeting criteria for A, B, and C, but I am in a lot of distress and it is affecting my relationships. That's really the kind of golden thread we were seeing, is that relationships, marriages, friendships, parent to child relationships, those were all suffering in some way. And there's really not anyone else in Chester County, let alone like the surrounding area, that does exactly what we're doing, which is the trauma focused. And so we were both certified at the time. I think Joe was coming up on his certification. And so we said, let's do this. We really want to um, go further with our education, and we really want to focus just on doing this type of care. And that's really hard to do in a general mental health setting or even a higher level of care, just because there's stabilization needed and there might be higher acuity of symptoms. And so we really just wanted to do this kind of work, and we used our resources, we used our network, and it took off. It got really busy really quickly because there aren't a lot of people that are just doing this. You might have practices that have one or two people doing EMDR, for example, but maybe they're not certified. Maybe they're just trained, which is fine. That's how you learn. But we found that come in specifically wanting that certification because there is more education involved with that.
That's awesome. That's awesome. Yeah, I think it's really important. That's why I started the Bloom Sanctuary. So it's like a pure form of
Mm,
something instead of it being lost. Because it was very hard with my
exactly.
former office to combine sports medicine with chiropractic for pregnancy. And people didn't get it because it was like a very athletic, known place. And I think for me, with what I've been through in the last 6 years, having the term sanctuary was so
Hmm.
important to me because a lot of people that I hear, I don't know if it's a political climate or what's going on. A lot of people discount what trauma is to people and how they interpret trauma. And I see that a lot with my pregnant patients, where I've literally had guys at the front desk being like, boo hoo, that's what women are made for. And I'm like, I want to stomp them.
Sure.
Like,
Yeah.
or they're like, or people will say something like, well, at least you got a healthy baby out of it, or at least you're
Right.
okay. It really discounts one of the things I've been very open in my journey. I think anybody who's really passionate about something
Hmm.
has a story with it, which makes them passionate about something. And for me, realizing with through therapy at 50 something, we met before I went through my divorce, correct?
I think so.
And
Yeah.
yeah, so I'm a very different person than that because, and somebody could say, like, wow, you're really, really anchoring yourself with trauma, but the trauma made me who I was and made me
Mm-hmm.
create the mega practice that I did with all the offices. So trauma can be used as a good thing, but it doesn't discount the feelings, and feeling those feelings. And a lot of the things that I was using to cope with that was work to sort
Hmm.
of distract. So, can you talk to us a little bit about numbing behaviors that you might see, or some signs that maybe you're not admitting that something was traumatic because people sort of shit on that experience or should on that
Hmm.
experience, same thing, where they're like,
Exactly.
you should be just grateful. I think that's the biggest thing that pisses me off with pregnancy is to say, oh, you should just be grateful you're pregnant when somebody is dragging their leg or can't put
Yeah.
their own pants on. Talk to me about that, about other people shitting on your experience. I said that distinctively because it could be taken both ways, shitting and shoulding on your
Yes.
experience.
Well, and I would just like to comment too on what you mentioned around like getting through that experience obviously was awful, but there it also made you who you are and gave you, the experiences of what you have today. That's what we would consider post-traumatic growth. So we're all going to go through our own journeys, our own stuff. Some of that might be horrific at times, but at the end of the tunnel, the goal with any sort of trauma work is post-traumatic growth. What do I take from this experience as I go forward? Because we don't want to get stuck into, well, what happened? What could I have done? What could I have done different? That just kind of gets our wheels a little bit stuck and it is really hard to go forward. So just even putting a name to what you're naming is, something to call out. In terms of numbing behaviors, I mean, it can come in any shape, form, size. We would call a lot of those behaviors are dissociative, so they're disconnected from the present. And this can look like overeating, oversleeping, overworking. It can look like the opposite. I'm disconnecting and I'm having trouble going to work. I'm having trouble sleeping. I'm having trouble eating. We're really looking at basic functioning of activities of daily life. So, eating, sleeping, connecting, being able to go to work or school, being able to connect with those within your social circle. That's usually where we see people that start to come in because you have to also think there's a motivation, especially in this culture and kind of how you were sharing before. I think that women specifically get this messaging sometimes of like, oh, well, just keep going. Like it's not that bad, especially in comparison to, this other situation. And really what we're looking at is when people are coming in, what is that motivation? And it's usually because one of those domains, or in oftentimes most of those domains, it isn't just, oh, well, I'm, having trouble sleeping. Let me go get some trauma therapy. It's usually all of those domains are disrupted and usually severely by the time that we're seeing someone. For someone to actually feel like, okay, it's bad enough for me to come in. And it is unfortunate because part of what we do too is prevention. Somebody might be within our care and we're working on something from childhood. It's really a relational dynamic might be triggering someone in their marriage, or
Mhm.
newborn babies, right? New moms. That's something we see a lot when the dynamic changes because now there's another family member and now there's a whole new world to navigate. And that can often be a trigger for old relational patterns as well. But someone might come in for that and then something else happens. There's a trauma that occurs when they're already an active client, when we're already engaged in care. And part of our work is to mitigate that from going into a full blown PTSD diagnosis. And not everybody knows that. I'm thinking of someone I had before where we were working on some, childhood stuff, and they were in a car accident, and it was just a passing comment to me, and it really stuck out. So I was curious and, asked a little bit more, and they're like, "Oh, well, I'm not sure it's that big of a deal. I just wanted to mention it." And I'm thinking, it could be that big of a deal. I don't know what else is connected to that. I don't know what else, your adaptive information network within your brain is linking up into that. It could be something or it could not be, but we just want to keep an eye on it so you know what to look out for. If you start having nightmares or hypervigilance, or you're starting to avoid area where this accident happened, or maybe you're getting fearful or a little nervous to just drive, things like that is just really important to keep in mind, because half of the work that we're trying to do is preventing something from escalating and getting worse. We don't ever want a diagnosis to develop if we don't have to. So there's lots of things to look out for. And I think the takeaway too is you don't have to be at the worst part of your life, not knowing what to do, feeling really desperate in order to, one, be available to go in and get care, but two, to have it work. Because the less that there is to sift through, the easier it is to get through, excuse me, whatever that situation might be.
I talk a lot about, I've been doing a lot of videos about my second or my third book. Sorry. It's like what your partner doesn't expect and how to help. And I wrote that in response to my experience of interviewing 30 dads who I feel like are doing it right and are
Mhm.
similar along the relationship that I have now, where there's a lot of communication and articulating your needs instead of just stifling them. I think a lot of people avoid conflict, especially women. Were groomed to sort of just go with the flow and keep things peaceful. And what I've been talking a lot about, and I'm curious to hear your perspective, is part of what I wrote, as much as it was talking about weaponized incompetence that I see in my practice with men specifically. But the other thing is to have an empathetic vantage point in terms of both of you are changing and all the attention is on your partner, and your partner's not acting in a way that you're familiar. Like, people are very familiar about how when somebody acts different, it creates change, and it might start triggering the dad of, hey, she's getting all the attention, the baby's getting all the attention, and they act in ways. Like, I brought up one the other day where I had a guy literally screaming at his wife, who was literally snot covered in her pajamas because she had stabbing rib pain for 4 days, and she was crying. She kept him up all night, and he's like, can you fix her? So I sent him out of the room. And at first I was like, I was going to kick him out of the office for treating her that way. But when I got down on my knees, in terms of like going, because it started crying, I realized he didn't have the emotional capacity to deal with that. And it came out as anger because he was uncomfortable, which, it's so interesting to me how both partners are triggered in their inner child and their traumas. So talk to me a little bit about stuff with that, of working through that in a relationship, of your partner's reaction may not, I just think anger was just anger, but it's more deep than that. Can you talk to me about that? It's sort of like a lack of control and emotional
Oh yeah,
regulation. Yeah,
this is a
I
whole other
love this shit.
session.
Now that I didn't know about this before I got divorced, and it really
Yeah,
was helpful because with my partner, we have not, I'm going to knock on wood, we've been together over 2 years and we haven't had a fight yet. We've had some
yeah.
discussions, but like respecting the other person's vantage point and realizing their reaction is in them, it's not a reflection of you, is
Yes,
such deep stuff, and it's hard
it
work. So talk
is.
to me about that.
It is hard work. Yeah, what you're reflecting is something that we work with all the time. And often what will happen is I'll see usually the female member of the relationship, and then Joe will see the male, usually. And then there's an opportunity once each member of that relationship has done the individual work, including working on their inner system and their parts, for coming together. Because what ends up happening is, I have all my stuff, I have my parts, I have my baggage from, childhood. Almost always, everything goes back to childhood because it's all about attachment. Same thing with the other party. They have their stuff, they have their experiences. And if I don't have an awareness or if I don't know what is coming up within me when I'm in this argument or this conflict or whatever the trigger is, I mean, you have to have an understanding of, okay, well, what is activating me? Then you have to have the ability to look inside and be able to tell, what is coming up? Like, what is this related to? Does this feel familiar? That's often a question when we're working with parts. So IFS, parts, inner system, it's all kind of interchangeable. But we're always looking for those connections because when we talk about doing this kind of depth work, the motto is the past is the present. So what
Really,
is
you know
happening
what it
right
is.
now?
Yeah.
What's happening right now is not brand new. This is something that your body is holding on to. So that somatic tension, and it's familiar. It triggers, when we get into the brain and, why we get triggered and what that looks like. The limbic system is really what we are working with at the Willow Space. We're really working on getting and essentially processing through eventually all of that held on stuff from the past that didn't get to get processed at the time for many, many, many reasons. So then you get into conflict with your partner, my parts are coming out at your parts, and then it's never the adult part of you that's actually having that conflict or conversation. It's my 10-year-old and your 15-year-old duking it out, and that doesn't usually work too well.
Yeah, I usually say to him, like, my lizard brain says this, because I know
Yes.
I'm very aware of my own shit because I took a break of dating because it was such an utter shit show getting out of a 26-year marriage. Like, I was 22 when I got together with my ex husband. So, like,
Yeah.
coming out, like, I didn't know what what was it? Ethical non-monogamy, something ethical non-monogamy or something. And I was like,
Mm-hmm.
oh, EMR something. And I was like, yeah, that's my favorite band. And they're like, no, that means like you can see where you want. I was like, oh my god, I'm like so like I'm like the Rip Van Winkle of dating. But like for me, I had to take a break because all the men I was attracting were like rich, very sarcastic in a bad way. I like sarcasm. And just cold and avoidant. So I had to take a break and be like, clearly I'm on the wrong floor of the department store and I'm like I'm in the bargain basement and I need to take a break and work on myself. And in doing
Yeah.
that, I healed myself and did the
Mm-hmm.
hard work of all that stuff. But even getting back into the relationship with my now husband, like hypervigilance is such a big thing because I'm not used to having anyone help me. And if you cling to that, that's like a trauma response where it's like, I'll just do it on
Absolutely.
myself. But that
And that has
what
limitations.
my god, it's so hard, and it robs the other person of being able to help you. So we've had to work through that of like he's like a traditional man, so my
Yeah.
kids are just like what the hell, like. But it makes me feel soft when I let him do stuff for me,
Mm-hmm.
which I just said let him do stuff. But
And I let him.
it's such a minefield of like even leaving something on the floor in my marriage, I would have gotten in trouble for that. Do you know what I'm saying?
Mm-hmm.
So you have to like
Mm-hmm.
undo that, but your body reacts in a way where you're like shaking, like, oh my God, I'm going to get in trouble or I'm sorry for everything. So it's just like undoing a lot of those patterns and being aware of it to be able to step outside. Like part of the reason I got divorced was one of my 85-year-old mentors shared the power of now with me and
Mm-hmm.
it had nothing to do with marriage, but you're not your thoughts. They're like a record that you keep playing. So if you can step out and look at it, that's so much more healthy. And I think that's part of the reason I have such a more mature relationship and a healthy relationship. So tell me some conflict resolution. If you're a pregnant woman right now and your partner is just like you're scared, right? And I think that's the part
Mm-hmm.
that I'm out to normalize, even though it's not normal, it's common, is you're going to have physical problems during your pregnancy
Mm-hmm.
and empowering OBs who are not trained in sports medicine to help them mystify this does happen instead of telling them it's normal. Tell them it's
Mm-hmm.
common. These are some solutions you can try. That fear triggers people because they feel like they're not going to get out of it. They're carrying such a load with their other kids. It's usually a second pregnancy thing. They don't want to
Mm-hmm.
rob. They're carrying so much. How do you help a couple through that? How do you help the partner who's pregnant and the partner who's just like, what the hell happened to my wife who had her shit together in the first pregnancy and she's like a freaking mess? Like, how do
Yeah.
you, what are some tips you would do to call a timeout? Because I'm not a therapist. when I'm in these rooms. Like, what
Yeah.
are some things you can do that are helpful for somebody that's really in a dysfunctional pattern right now with their partner?
hmm Yeah, I mean, I think the first step is always just validating and being able to hear. And, validating isn't accepting or saying this is right or okay. It's just saying, I understand this is where you're at. I understand this is what you're feeling. Reflecting back, making sure that I have this right. That's always a very good step just to make sure that everyone feels heard, feels seen. It doesn't feel like you're taking sides or trying to like problem solve. I think for some people it's they want the problem to be solved, but then the other half is like, well, that doesn't really fix how we got here in the beginning, right? So just acknowledging this is where we're at. And then what I think is really helpful is just starting to look for those patterns. Typically when we see this come into the practice, it's usually not like this is just happening out of nowhere. It has been a pattern in some ways. It might be triggered differently, it might be presenting differently, but a lot of that is psychoeducation around, well, this is why this happens, this is why this might be more hard for her, this is why this experience is happening in the way it is now. Because oftentimes I think as providers it's easy to just assume that what we know might be common knowledge, or what we know is something that everybody else is aware of, and that's not always the case. So really checking in around, are you familiar with, A, B, and C, or have you ever heard of this term, or have you ever, felt this way about anything else? Really just trying to bring in a common ground so it doesn't feel like, me versus her or us versus them. You really want to find how we can come together. And it's really just trying to look for patterns. Again, this is probably not a new situation, and it's really common for people to go for content. So, my wife is acting crazy. She can't handle this. I don't understand. It wasn't like this with the first baby. And that might all be true, but therapeutically or clinically speaking, we're not detectives, and it's not our goal to figure out or to problem solve or to give answers. It's simply to just draw some noticing to patterns to see, why might this be so activating. So yes, there might be some truth in that content, but how we really try to reframe that, and what we teach our clients here as well, is learning to reflect on, okay, so I'm noticing that maybe she is more easily upset, or maybe she's more forgetful, or maybe I'm not getting my needs met in the way that I was previously. What about that is so activating for me? And
Mhm.
usually that's when you're not you're not in the conflict. This is later on when things are settled, calm, you're in that adult presence, and really taking some time to reflect, because 9.5 times out of 10, this is going to come from something else that, again, the body remembers. You're going to react to it and have feelings to it long before you even remember or like recognize, what am I actually upset about? And so just taking that beat to settle and start to look at some of those themes. Trauma work is all about themes. We're not looking at individual situations, or like, well, this happened, this time, and this time, but it was different this way, this way, this way. That might be true, again, content wise, but the overarching theme, I'm feeling unheard, I'm feeling neglected, I'm feeling helpless because I see that my wife is in pain and I can't do anything to help her. So once you can get some settling and really get into the depth of what this is really about, that's where some change can happen. And within IFS, that's where we would say we can really start to extend some compassion. We can really have some understanding, or we can really develop more patience to understand and really get why this person is struggling in this way.
Yeah, because it's out of the ordinary that they would act like that. I think that's really what's
Yeah.
important. Because I had somebody
Yeah.
recently say in my treatment room that somebody had their head up their ass, and I was like,
Mm,
"Wow!" I said, "Do they usually have their head up their ass?" And they're like, "No." And I'm like, maybe it would be important to say that there's a reason that they have their head up their ass, if that makes any sense. They're like, what's going on in their
yeah.
life if they're typically.
Curiosity. Extending some curiosity.
I think one of the
Hmm
things that one woman that I work with that co-wrote my book with a partner book, because I her husband is like the pinnacle to me of like the perfect partner. Like he was the only person that at the time 2 years ago that I knew that was like the perfect husband to me and from her vantage point. But she and him really do a lot of hard work of sitting on the same side of the table. Like when they're sitting on the same side of the table, the problem's over there and they're
Mhm.
working together. But I think
I love that.
when yeah, I love that too. So that's why I asked her to cover with the book because I was like, I come from such unhealthy. Like my parents are happily married; they adore each other. But some of the trauma, the relationships, the trauma in my life,
Mhm.
and my marriage, and everything, has led me to have some different beliefs about myself, which drives me to do this today. But I think for a lot of things that I see in relationships, typically the guy wants to fix everything
Mhm. Yep.
like that without understanding. And I think for
Mhm.
women, and maybe I'm generalizing, to not be understood, to figure out why is this happening so this doesn't happen again is equally important. Because we all know that like video about the woman with the nail in her head and the
Yeah.
guy's like, he just wants to take the
Not
nail in
about the
her head. And
nail.
she's just like, no, I just want to talk about it. So like I love that video. But
Yeah.
I think being understood and being validated that maybe you're not right, but your brain is activating in a certain way and pain brings that out. I think what I see so much with pregnant women is they're getting gaslit unintentionally by their OBGYNs who are saying, what do you expect? You're pregnant. And
Right.
I teach that with the Eagles. I show the Eagles behind me of them getting hurt. They have a team doctor, a team chiropractor right on the sidelines. They're not told, what do you expect? You're a professional athlete. They're out playing
Exactly.
without, like it doesn't make sense. It's so misogynistic. And I think that hurts because it invalidates that they're in pain. I think part of that in this country is that women are seen as a container. Like they're just sort
Mhm.
of like not important anymore and their feelings aren't important. And then at the same time on Instagram, they have these like women that are like bodybuilding and like looking pretty and it's not being in your body. Do you know what I'm saying? And there's this aspirational thing that you need to be beautiful and fit and all this shit and you might not feel good. And at the same time, everybody around you treats you differently because you're not the same. That's why I call my business Bloom, because women change so much, but when you put that with pain, it ruins that like natural process. It makes you doubt yourself because you don't feel good. Like you legitimately don't feel good. Can you talk a little bit about that, of that identity switch? Even per pregnancy, it's not even just your first pregnancy, it can be the second pregnancy of like, I'm outnumbered now. We're outnumbered. It's hard. It's a hard stretch. So can you talk a little bit about that? Or in having the baby, if you've had sexual trauma before, like that
Mhm.
brings up so much of the delivery. I know for myself, like I dissociated with both my deliveries because of sexual trauma, because it's so dirty. And I know, like I just said that word, and I know birth is not dirty, but I have such a block with that because of what's happened to me that I
Mhm.
totally blocked it out. Like it's just not even, and some amnesia is normal with childbirth, but
Mhm.
like that part of it was so traumatizing. And then I've disclosed a lot of times that my ex-husband wouldn't let me cuss at all. Like I was not,
Mm.
he warned me that he would leave the delivery room if I cussed at all. And I was so scared to mediate his feelings, to behave. And it was so, that may not sound traumatic, like boo-hoo, me, but it was scary for me. Do you know what I'm saying?
Oh,
Because I didn't know how I
yeah.
was going to act.
And you're
Like
not in a
birth is
place where you're going to be mediating your actions either.
extreme amount of pain and they're like, don't
Yeah.
cuss. Like I cuss freely for fun, like never at people.
Sure.
Like F is my favorite word, but like never at people. But like if I'm in pain, like if anybody stubs their toe, that's the time when somebody's going to cuss inadvertently. So like
Yeah.
I was so
Absolutely.
terrified of being embarrassed of him leaving that like it ruined. I wasn't able to be in myself and take care of myself. I had to mediate a grown-ass man's feelings
Right.
who really shouldn't have been in the room. Do you know what I'm saying? And at the same time, I
Absolutely.
couldn't ask him not to be there because that would be criminal to not have the father of your child there. So it was a real mind screw for me, and it's
Mhm.
something that I'm still working on, of being okay with that and reconciling that happened to me and moving. And that's why I put so much into the way I work with pregnancy, of making it better for other people, or being aware that you don't have to mediate another person's feelings. Like I know that now at 52 years old. At 23 years old, I didn't know that. Do you know what I'm saying? And helping women realize their value and that they matter too. I mean, I know it was just heavy what I just talked about, but mental health is so
Yeah.
stigmatized. I think I wanted to talk to you about that. Like I talked to somebody the other day that lost, multiple babies, and she's a doctor. She would hide her appointment with her therapist on her calendar because she didn't want her assistant to see she was going for mental health help. And I know in my own family, people have said, "Oh my God, do you realize so and so's in therapy?" I'm like, they're the one who needs it. Like the people who don't seem like they need it. Can you talk a little bit about that in terms of like people's stigma with mental health?
Hmm.
It's really criminal because where are you supposed to get help? Do you know what I'm saying? Like you're supposed to have all
Right.
your shit together. Talk to me about that, topic.
Yeah. I think that goes back too to what we were speaking about earlier about prevention. Our society, America does not value prevention, and that's one of the issues with our healthcare system is that you have to meet a threshold to get a
Yeah.
diagnosis, to then be ill enough or sick enough or, whatever that system wants to call it, to get the treatment. But the reality is, if you were to come in when you first felt ABC or when this situation first started happening, you might not be in the situation that you were, which you are now, which would mean you wouldn't need as much treatment. It wouldn't be as intense. It wouldn't be as compacted because the way our brains work, right? When something, I guess to back up too, trauma for the brain, it's just something that's overwhelming. It's just something that we're not able to
It floods your
process.
system.
Exactly. It's the same thing as if when you eat too much on Thanksgiving Day, like your system can't process all of that the same because you don't eat this food in this amount all the time. So a physical comparison is something similar to that. So it could absolutely be someone making a comment that just didn't sit right because it relates back to something that has been a theme throughout your life. And cognitively, that's never going to just automatically click unless you're really doing some work because it's not in your neocortex, your thinking brain. It's in that limbic system, your fight or flight. So that's why you get that somatic feeling of like, oh no, I'm in trouble if I cuss during my delivery, and what what happens if I do? What are my consequences? What's happened before? It all ties into those previous experiences. And unfortunately, like because the way that we look at healthcare and specifically the way we look at trauma care, by the time that we're getting people, like it's already ingrained. So then we're having to go back and essentially, like you said earlier, we're rewiring how you think about what's happened, how that relates to you now. We're helping to rewire your limbic system in some ways because when we talk about like window of tolerance and regulation versus dysregulation. We have hyperarousal, which is that external, frantic, like do, 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 do. And then you have your hypoarousal at the other end of the spectrum, the shutdown, the disconnection, the dissociativeness. And oftentimes, what I see, particularly with women who are struggling with partners, and there's usually children involved in some capacity, they're just bouncing back and forth. It's I'm super, super activated, but that doesn't feel good. So gotta shut that down. Ooh, little too shut down. So like, let me go do A, B, and C to like feel something again. It's that struggle to be in that like green area of that baseline. And by the time someone comes in, if that is already ingrained within your alarm system, your limbic system, we then have to like go back, rewire that, give you a baseline of what does it feel like to be calm, to be safe enough, to be to be. And for a lot of people, felt sense is not there. So when something's happening, particularly like a pregnancy, even if it's fairly normal, you're still going through a lot of changes. You're still feeling a lot of different things. You are changing by the day. That is not something that if you haven't had that experience before, you might not have a felt sense of what does this mean? What do I do? Is this
You can't
normal?
step
And
out of it. That's the thing. You can't step
and
out.
you can't.
Yeah, because
So if
when I
you're
teach, I strap on a belly to these guys. I'll teach like 500 guys because most
hmm
chiropractors are guys that I teach, which is why I talk about football. But I'll strap on a belly to one of the guys. I'm like, whose wife just had a baby? And they're like, this is miserable. And I said, yeah, it is miserable. Like he's like, my back hurts. I was like, I understand, but like you can take it off. Like she can't step
yeah.
out, think straight, and it's like, and then you have like the guilt of like carrying those stress hormones and being like I've talked about that. My kid is autistic and I had such a stressful second pregnancy that I you feel responsible. Like do you know what I'm saying? Like you're doing your best to just keep yourself afloat. And then you're responsible you're the one who's carrying the baby. Do you know what I'm saying in terms of that? It's so loaded. Like it's just such
It is.
women are so strong, and it's just we're just trying to do our best. Talk to me. There's it's been a lot with parental estrangement. I know I'm switching gears, but a lot
Yeah.
of you
Hot
women who
topic.
are having babies, I've noticed my daughter's generation. She's born in 1998. They're cutting
Mhm.
off their parents
Yep.
because they
Yep.
don't want to deal with it because they're flooded. They don't want to do conflict resolution or whatever. It's more popular. I know Oprah did this big thing about cutting off
Hmm.
your parents because some of the behaviors of my generation that were passed down from my mom are seen as toxic. Do you know what I'm saying?
Hmm.
Of being self-centered or talking about yourself or being intrusive or the stuff that worked as when they were a kid doesn't work anymore. And the respect isn't there. I had to work a lot on myself with my kid of not seeing them as a kid. Do you know what I'm saying? And they want you to be soft. Like you're like, my mom expected me to be like tough. You're out of the house, like you're done. And
Hmm.
my daughter's generation, which I saw when I was a boss in the workforce, they want more like the soft. They want to be treated like a kid. They're still baby, is what my daughter says. They're still baby. And if you don't get that, you get cut off. Talk to me about what your thoughts are of why a lot of my daughter's generation cuts their parents off, or why people cut people off because I perceive it's a lack of safety within themselves. Like that's
Hmm.
why I typically will cut someone off because I don't feel safe with that relationship around me, so I'll just be done. I never go after people; I just cut them off, which is
Yeah.
not the healthiest thing. And I'm learning that I need to be okay with myself, that I can still be around that person or interact healthily. It's just like I just like done, cancel.
Hmm.
But talk to me about that of why people would do that.
Yeah. Very common with the younger generation, but also we're seeing it a lot with millennials, so like 30s and 40s. And I think a lot of it, to your point, yes, I think there's that I don't feel safe around you, and I'm realizing I have a voice, so I can do something about this. But I think it's also just increased education, there's increased knowledge, whether that's appropriate knowledge or not. There's a lot more access with social media. It isn't just, I have to do this because this is what families do. There's more access to therapy. There's more people talking about these experiences. And, just thinking about the clients I've had who have gone through the process of cutting off a parent, a lot of times it's the parent has their own mental health issues. And the child gets to the point where they've done enough of their own work. They feel like they've spent a large portion of their lives trying to parent the parent or trying to get the parent to do something different, which is, obviously not worked. And they just get to this point where it's like, I have to focus on me. And sometimes that's met with resistance, and the parents get really activated and kind of fight back. And other times, I mean, nothing. The parents just don't respond at all, and then it's complete estrangement. And I would agree that it does have a lot of roots on the individual who is doing the estranging. What does their attachment look like? It's often disorganized because the parent was overbearing but also really critical, or was available in some ways but not available in others. And so when you get that push and pull, and when we talk about attachment too, we can think about the wall analogy, is that for a child, you want to be a strong enough wall so that the kid can come back, they can touch base, they can get what they need, and then they can venture off when needed. And if you're too strong of a wall, it's overbearing and the kid doesn't want to come and it doesn't go to you for their needs. So they're avoidant and figure it out elsewhere. But if you're too crumbly every time they come near you and there's too much anxiety, then the child learns you can't handle what my needs are. And so again, might go elsewhere to seek that out. And when you have a mixture of both, that avoidant and that anxious, and it's just constantly push and pull, you do run that risk of having disorganized attachment, because it's really, really hard to tell, like, when can I go to them? Is now okay? Should I not? Can I get my needs met with this? I know I can't go for there. And it becomes this like overactive limbic system of trying to figure out and police the environment to just simply see, can I get my needs met here? And I think people just get to the point of doing their own work, having increased information and just getting to a point of like, I don't want to do that anymore. And I'm not seeing anything on the other end that says that you're willing to do something different. So I'm out. And in some ways it's hard to blame them. Like
Yeah.
you can
I see it a
only go
lot with
through that
people
for
who have
so long.
babies for the first time, and the moms don't respect their moms, or their
Yes.
husband's moms don't respect
Yes.
their boundaries. And it's really
Hmm.
crazy to me because it's not their kid. Like where I've seen where they force themselves in, and it's like they don't respect. Like, I deeply respect every patient I have. It's their journey. It's not my time to insert my bias about what they should do, because frankly everything's sort of like a crapshoot with pregnancy. There's good and bad. But it floors me when women, like, I'm 52, I'm entering the grandmother phase, God help us all, but where they insert themselves and make it about them and their role. And while that's important, it's important to understand that your kid gets to pick their way to parent, and
They're
you need
adults
to respect
now.
your kid, and you need to
Mhm.
respect their way of parenting, even if it's against the way that you do it. And I've seen some crazy stuff where people either circumvent the mother, or like, it's just crazy to me, or just drop by
Mhm.
whenever they want to or whatever. And that could be traumatizing, because then you have to put up the wall where you're just like, you're not respecting basic boundaries with me. So there's so much, as I said, birth is and pregnancy is such a loaded time, because it's a temporary, vulnerable situation where nobody
Mhm.
knows how to act, because this is a 9 month window, or a 10 month, we all know it's 10 months, a 10 month
Mhm.
window where stuff is a little bit different, and people are going to be acting differently because they're not the same. What's the best advice you could give somebody in closing of like how to regulate themselves, or how to feel themselves, or how to find help? Like, what's your best advice for somebody that is really struggling, and they think that they're doing it, but they're really realizing that they're not handling things in the right way? Not in the right
Mhm.
way. Not in the right
Yeah.
way. It's
Well, in a way
affecting
that's not working
their,
for them.
yeah, it's affecting. I think for me, like, when I speak, and I'm not a therapist, I talk about it's totally common to have anxiety. Like, it's not, nobody
Yes.
doesn't have anxiety. So let's just take that off the
It's
table. You're not
normal.
bad for like, I have severe anxiety at times with certain things. So like, even somebody like me, everyone thinks I have balls of steel. I don't sometimes with certain stuff with my kids and stuff. There's certain areas
Mhm.
where I'm vulnerable. Do you know what I'm saying? To being anxious, because if you care
Absolutely.
about something, it's normal to be anxious. It's how it stops your life, or like you
Mhm.
said, affects the relationships that you have with other people. So what's your best advice for that, of like, hey, I need to get some help, or even some self-help tips? Like, I'm very big into self-help tips before you get to that point. What are those
Absolutely.
for you, your best advice?
Yeah, so I think too, just remembering and recognizing that emotions, like you said, everybody has anxiety. It doesn't matter how much therapy you do, how many meds you take. Anxiety is a normal part of everybody's life, and we need it. It helps to alert when something's off, when something's wrong. Pay attention to this. And so the goal is never to not have anxiety. The goal of this kind of work is to acknowledge, one, okay, it's feeling a little bit more escalated, or I'm feeling it more often, or it's hurting my life or getting in the way of my life in some ways. It's never to get rid of it, because you need that. It helps keep you safe. And so when you're starting to notice emotions escalating, particularly if it's affecting school, personal relationships, work, sleeping, eating, all of that, that's really when we want to start paying attention, just taking some notes. I usually have people just, a lot of times in EMDR and IFS, it's all about noticing. That's kind of the theme, is noticing what happens, noticing what comes up, and just going into your phone, making a little note. And if you're feeling, more anxiety than normal, just putting a little note of when you notice it, what are you noticing in your body? Does this come up in my chest? Is this a stomach feeling? Do I feel like I just want to sit down and cry? Do I feel really irritable? And what happened right before I started to notice that? Because again, it's just about themes. It's about really starting to bring some presence and awareness into, why am I feeling this? And not that, we have to figure out why, or that there's really a like singular answer, but bringing the awareness is really the first step. And that's really what you would do with doing any kind of this work as well. and to do it before it gets to the point where it's unbearable. You don't want to wait until I'm debilitated, I can't leave my house, I'm not going to work, I'm not eating, I'm not showering, because at that point, it really is hard because it's already been ingrained. And so if you think it's too early, that is probably the time to start looking, either doing your own reflection, maybe starting to do some research about providers. And there's tons, I mean, in the area as well as throughout the US. EMDRIA is the accrediting body for EMDR. So EMDRIA, I think it's .org. They have a whole find a provider site. So that's a great place to start if you're really looking for trauma-based work or somatic-based interventions, um, or just doing a Google search around, EMDR providers or somatic providers. There's tons of information out there. Really just looking to see, where do I start? That's the hardest part.
Yeah, I've had a great conversation with you, Erin. And one last thing, because I love how you explain things. Can you talk to me about how boundaries don't feel good?
Yes. Yes,
That's
I
why that
can.
was 125 for me. Is like you think you're going to be proud of yourself, and it's going to feel so good. Talk to people and reassure them of those new patterns, just like a record. Do you know what I'm saying? When you do things new, I just love how you explain things. So you explain a little bit about your thoughts about boundaries, and then we'll figure out where to find you. I was just thinking, I was
Yeah.
like, oh my god, I would love for you to talk about that because I think that's what stops people from changing a lot is the uncomfortableness of a certain boundaries are for who, Aaron?
They're for
Yes,
us. They're our fence.
they're not
They're
for other
your fence.
people. Yes.
They're not for other people. It will be uncomfortable because you're often taught that if I put up a boundary, that means I'm shutting other people out. I'm being selfish. I'm a bad person. And so we have to identify, well, what is the script that you have about putting up a boundary? One, what is a boundary to you? Because often people think it's for someone else, or, oh, well, I've told them don't do that and they don't listen. So why would I keep doing it? Well, it's not for them. That's your side of the fence. That's for you to put up. If the other side of the fence wants to kick through or not abide or try to hop over, I mean, that's a different conversation, but it is for you to assert, hey, I'm not comfortable with this, or I can only do this, or I'm only willing to go this far. And eventually it does get to the point of consequences. If I keep setting a boundary with you on, hey, Brandie, I really don't like when you say that word, and you continue to say that word, and I feel really strongly about that, the next step might be, if you continue to say that word, I can't be in this conversation, or I have to leave, or I'm not able to continue being in this relationship. So it's a progression. You're not going to go in hot saying, if you don't stop doing this, I'm going to do this, because it isn't an ultimatum. It's, I can't do this because I'm not comfortable with that, or that doesn't feel good. And eventually, if you continue to do this, I will have no option but to exit the conversation, leave the situation, maybe not be able to talk to you in these settings. Whatever that looks like is pretty individual, but it's a learning process because we usually don't have boundaries due to what we've been taught they are and what it says about us when we set them.
Yeah,
So it
it's
will
really,
feel uncomfortable.
especially in pregnancy, it's really important because these boundaries are going to be new. Who gets to see
Yes.
my baby? Who gets to touch my
Right.
belly? Which is insane to me again.
Yeah,
Used
exactly.
to say dumb shit to me. Like it's just like the list goes on, and you're really finding. I think it's part of the process of growing and finding yourself and blooming into. That's why I call it bloom, blooming. So, how can people find you, and what's a good client for you, and what's your process, Erin?
Yeah, absolutely. We are on our website, so willowspacefortraumatreatment.com. We're on socials, most active on Instagram, willowspace_ for trauma treatment. And the best way to get in touch with us is probably the website. And we have a couple of therapists who work here with all different types of specialties. I work primarily with working women, so that's my demographic. And then we have a couple of therapists who work with the LGBTQIA community, chronic medical conditions. We have a therapist who works with adoption issues. So we have a wide variety of who we work with, specialties, clinical, all of that. All of that's listed on our website if anyone's interested in looking at that further.
I really enjoyed having you on. It was really illuminating. As I said, I'm not a therapist, but chiropractors say 80% of what walks into a chiropractic office is emotional, which is,
Absolutely.
and you, like your services are really life changing for people to help them feel more of themselves. I know for myself, going through therapy through my divorce really changed me into a different person. You said alchemized taking negative situations and turning them. That's the best way that I find with trauma, is to turn it into power, of
Yeah.
helping others. And it gives you purpose. And I know that your work is really deeply personal to you and purpose driven for both you and your husband. And I thank you for having that. I'm so excited to be your neighbor now that I'm in
Yes,
Portland.
absolutely.
Um, yeah, it's a whole new neighbors, which I'm really excited about, and a new start. But this has been another episode
Yeah.
of Pregnancy Pain Sucks. If you are having a mental health issue, please don't feel embarrassed to find help. As you said, Erin, it's so common. Please don't let other people's opinions or whatever, just find somebody that you can get help, because that's the most important thing. So I thank you for being on my
Absolutely.
podcast today, and it's been a pleasure.
Yes, thank you, Dr. Brandie. Thank you for having me.
Thank you.